So my name is Ashley Elliott and I am a consultant rheumatologist based in Belfast. Well, when I was younger, I wanted a career that was going to be interesting, challenging and varied, but ultimately something that was going to be rewarding. So I was inspired by the TV show House, which was a lot about medical mysteries and detective work, coming up with the best answers for patients. And so that seemed like a good fit. And yeah, I think it's been the right choice. So there's lots of things I find really rewarding about rheumatology. I really enjoy my job. I think firstly, we have a varied caseload of patients that we see. We see patients with acute problems, say with an acute hot joint, but also we see lots of patients with chronic conditions. We can see people when they're really unwell, and we can see patients over the long term and see a real improvement with the treatments that we provide. So I think there's been a huge change in the way that we manage patients with rheumatic disease over the last 25 years, especially with the advent of the biologic therapies. We can make a real difference to patients' lives, and we can get patients out of pain, particularly with inflammatory joint disease. I also love, as I said, the detective work, and there's a lot of that in rheumatology. You have to come up with answers for patients by listening to them, by taking a good history, by ordering the appropriate tests, and then putting that jigsaw together to try and solve some of the more rare conditions that we deal with, particularly inflammatory muscle disease or connective tissue disease, vasculitis. So yeah, I like that I get to know my patients. I like that I get to see them over many years and develop a relationship with them. So yeah, there's lots of things I like about rheumatology. So I think firstly, they can expect someone who is warm and friendly, but someone who is experienced and is up to date with what is out there in rheumatology research. I have a lot of experience with the use of musculoskeletal ultrasound and carrying out my own research on patients coming up with better answers for those with rheumatic disease. So I think you'll have someone who is going to do their best and utmost to try and come up with answers for their patients. And yes, and I hope that's done in a friendly, welcoming, warm environment.